What's something illegal you did for the right reasons? I stole medical supplies from my hospital job for years to help homeless people, and I'd do it again tomorrow. I worked night shifts as a supply clerk at a major hospital in Chicago for almost a decade. My job was to stock and inventory medical supplies across different departments. Every month, I watched as perfectly good supplies, bandages, antibiotic ointments, over-the-counter pain medications, diabetic testing strips were thrown away because they were near expiration or packaging was slightly damaged. Hospital policy was clear. Damaged packaging meant disposal, even if the item inside was completely sterile and sealed. Straight to the trash. Meanwhile, 2 blocks away, people were sleeping in tents under the highway overpass with infected wounds and untreated chronic conditions. It started small. I took a few bandages and antibiotic ointments that were headed for the dumpster. Then it became a system. I'd carefully document everything as disposed in the inventory system, but instead of trashing these items, I'd put them in my backpack. Every Sunday morning, I'd walk to the encampment and quietly distribute supplies. I never told anyone where they came from. I just became known as the supply guy. I learned to bring what was actually needed. Diabetic testing supplies were in constant demand, as were wound care items and pain relievers. Over 5 years, I diverted what would have been about $43,000 of discarded medical supplies based on retail prices. Not a single item was taken from active inventory that would have been used for patients. I only took what was already designated for disposal. The closest I came to getting caught was when my supervisor questioned why our disposal numbers had decreased. I explained that I was being more careful about storage conditions to prevent damage, which was actually true. She praised my initiative and moved on. What I saw in those 5 years changed me forever. I met a former high school teacher who lost everything after a cancer diagnosis and couldn't afford insulin for his diabetes. A young woman who had fled domestic violence and was treating her wounds with paper towels from public bathrooms. A veteran with pheniciati who couldn't navigate the RIA system. The most heartbreaking was an elderly man who died from an infected foot wound that could have been prevented with basic wound care. That night, I took twice as many supplies as usual. I eventually left that job for nursing school, inspired by what I'd seen. I couldn't continue my supply route, but I made sure to train 2 trusted co-workers who continued the practice after I left today. I am a nurse practitioner working at a community health center serving unhoused populations. I work within the system now, but I still remember what it felt like to break rules that prioritize profit over people. Was it illegal, Orate? Would I do it again? Without hesitation. Sometimes the most ethical choice isn't the legal one, and I'll carry that knowledge with me for the rest of my career.